any exceptions to the requirements for a patient's consent?
Both ethically and legally, there are 3 exceptions recognised to the requirement for a patient's informed consent. That is in an emergency, an issue of mental capacity of the patient in question, and thirdly, the instance of minor consent. In a clinical emergency, obviously if a patient, for example, is threatening to bleed out in an accident emergency scenario, or that they need CPR immediately, that's cardiopulmonary resuscitation, then any issues of consent are negated because the priority is to save the patient's life. After that, then further issues of consent can be addressed subsequent to the patient's recovery from that emergency situation. The second exception is that of mental capacity. This has emerged in the case particularly of mentally ill patients. For example, whether a patient who is schizophrenic can give an informed consent. There is indeed case law to suggest that each case should be taken on its own set of facts and merits. In a very high-profile UK case, for example, a patient was ruled to be able to consent to a procedure even though they were a paranoid schizophrenic in the context of an amputation. The third exception is one of particular resonance here in Ireland, and that is that of minor consent. In other words, a patient is considered to be a minor for the purposes of informed consent if they are under the age of 16 years of age. In that instance, if they are under 16, then consent has to be acquired in Ireland from either their parents, their guardian, or whoever is acting in loco parentis. In England, there is what's referred to as the concept of Gillick competency. That suggests that a minor patient may be able to or have their informed consent accepted by the healthcare professional on the basis that it is the healthcare professional's expert opinion that the minor patient in question has sufficient maturity and mental capacity to give an informed consent in those circumstances. I think it's worth pointing out that here in Ireland we have not recognised formally the legal principle of Gillick competency, and therefore it's much safer to rely on the concept that a minor patient consent can only be acquired from their parent, guardian, or whoever is acting in loco parentis on their behalf.
And in other jurisdictions, is it the responsibility of the practitioner to understand any local agreements or regulation? If you could perhaps talk about that. Malaysia, Singapore, this sort of thing. In other words, if it isn't the jurisdiction of Ireland or England.
My understanding is that in other countries such as Canada and the United States of America,
I was just wondering if you could just add a sentence just to say, but of course jurisdictions may vary and it's the
I beg your pardon.
Responsibility to find the requirements in their jurisdiction.
Yeah, sorry. Obviously, a healthcare professional, if they move to work in another jurisdiction, particularly on an international basis, it is their legal obligation to understand the legal framework under which they will be operating, and indeed the ethical one set out by the relevant professional governing body. It may vary from country to country. For example, in Canada, there is a quite liberal and patient-centred approach set out there, whereas in other jurisdictions such as Malaysia, for example, there's a more conservative approach which is based much more on the judgment of the healthcare professional.
And what factors are there that could affect a patient's ability to give consent?
The generic term used in this context is the concept of undue influence. That can take a number of forms. Usually can be directly related to the patient's ongoing clinical condition. For example, both the ethical and legal guides in this country refer to the idea that undue influence can be based on either medication, depression, or pain. In other words, the patient's ongoing clinical condition can affect their ability to give an informed consent over the course of the treatment or procedure. Another form of undue influence, which again has been enacted in the Irish courts, is the concept of either a overly aggressive or overbearing family member or relative or indeed friend who may wish to seek to intervene and interfere in some extreme cases with the process of acquiring the patient's informed consent. That situation should be completely avoided if at all possible.